Once your baby is born, life down there doesn't just go back to normal as quick as you may think. During this postpartum recovery phase, a lot of changes are going on, and you'll be going through a variety of symptoms, with one of them being vaginal bleeding. In this video, you'll learn about the different stages of postpartum bleeding and what to expect so you can have some peace of mind during this recovery phase. I'm Annabelle Carney, and this channel is all about pregnancy, birth, and postpartum, as well as a little bit of family vlogs. So make sure you hit that subscribe button and ding that little bell down below. Our bodies are so incredible. Within the first few weeks of gestation, our bodies start making extra blood, which increases progressively throughout pregnancy in order to help supply enough nutrients and oxygen to your growing baby. On average, blood volume can increase by about 45%, or about 1,200 to 1,600 milliliters more than when you're not pregnant. The average blood loss after a normal vaginal delivery is between 250 and 500 mLs, and cesarean almost doubles that amount at 1,000 mLs. Any amount of blood loss over 1,000 mLs for both vaginal and C-section deliveries is considered a postpartum hemorrhage. So what to expect? So after you give birth, you'll have vaginal bleeding and discharge known as lochia. This can be broken down into 3 different stages that occur over a period of 6 to 8 weeks. Now, some of you may be thinking that this stuff won't apply to you since you have a scheduled cesarean, but even if you have a cesarean, you will still experience vaginal bleeding after birth. So why is that? Well, because your body just miraculously grew this entirely new organ, and it's how your body gets rid of all the extra blood and tissues from your uterus. While the lochia stage can vary from woman to woman, in general, it's important to remember that bleeding is heaviest in your first few days after you give birth, and then should slowly taper down in volume and brightness. You'll go through 3 stages of lochia: Lochia Rubia, Lochia Serosa, and Lochia Alba. The first stage, called Lochia Rubia, occurs between the first 2 to 4 days after birth. And in this stage, blood will be bright red to dark red and similar to a heavy menstrual flow. For this short stage, you'll want to use your largest pad, and you're more than likely not going to be wearing regular underwear just yet. So a great way to avoid any leaks will be to wear those sexy adult diapers and place the pad directly in there. And yes, it will feel super bulky, but because you don't really know how heavy you're going to bleed, it gave me peace of mind that I wasn't going to leak all over my clothes and onto the bed or couch. But it's up to you. Do what feels comfortable for you. So along with your blood, you may also see some discharge in your pad or the toilet that is thick in consistency or has tiny globs. This is completely normal as you are passing small blood clots, mucus, and tissue from the inner lining of your uterus. Now, don't worry, none of this is real blood or discharge. I just had to get creative in the kitchen so that I can give you guys a good visual because I think it's super helpful to understand. So anyway, a good rule of thumb, and your provider may have a different rule of thumb, but remember, they always trump what I have to say. So, if the clot is larger than a golf ball, this is a ping pong ball, but they are pretty much the same size, or if you're soaking through an entire pad within an hour or less, that is a reason to call your OB or midwife immediately. Now, stage 2 is called Lochia Serosa, and this starts about 4 days after birth and lasts about a week or 2. So during this stage, blood flow is a lot less and discharge begins to lighten to a pinkish brownish. So this discharge will be a mixture of red and white blood cells, mucus, and some microorganisms, all part of that healing process that occurs to heal that placenta wound. Now, the nice thing about this stage is you should be able to downsize in pads and you'll be wearing comfy, breathable underwear. And finally, stage 3 is called Lochia Alba. So this stage typically starts around 4 weeks post-birth and lasts for another 2 to 3 weeks. And by now, you should be able to graduate to one of those cute little panty liners. So in this stage, you'll notice that bleeding should be pretty much gone, and your discharge is now this yellowish white in color with no clots. So at this point, you're about 6 to 8 weeks post-birth, and your uterus is almost back to its pre-pregnancy size. And the discharge is mostly white blood cells, as well as some cells from your nearly healed placenta wound, as well as the inner lining of your uterus. Now, when do I need medical attention? So remember that postpartum lochia will be different for every woman, but here are some reasons why you would want to call your provider immediately. If you soak through a pad within an hour or less, or you're passing larger than golf ball size clots, or if your bleeding and discharge has a foul smell to it and does not smell like normal menstrual blood, or if you have a fever or chills greater than 100.4 degrees. Now, in the event that you're soaking through a pad in an hour or less, and you notice that you're feeling lightheaded, look pale, have clammy skin, notice any vision changes, or your heart rate's increasing, you should head to the emergency room immediately, as these are signs that you could be hemorrhaging. And lastly, here are just a few tips for your postpartum recovery period. So sure, the peri bottle is great for cleaning, but if you end up having a tear, that initial pee or first few days of peeing may actually sting. So to reduce the burn, you want to squirt your peri bottle as you're peeing to reduce the burn, then pat dry with a paper towel. Hydrate. You may be thinking that you'll just drink less water to pee less often and avoid the burn completely, but you actually want to drink more water to help dilute your pee, which will help your pee sting less. While swelling and bruising is completely normal after childbirth, you don't have to suffer through it. So all you'll do is just place one of those padsicles in your disposable underwear, and it will multitask as an ice pack to help with the swelling, a pad to absorb your discharge, and also help with the healing process if you have any tears or hemorrhoids. If you haven't watched my videos on the DIY padsicles, you can check that out right here. So that wraps up this video on postpartum bleeding. You learned what the 3 stages are and what to expect in each stage. You also learned the warning signs to consult with your provider and some tips for a smoother recovery. If you found this video helpful, please give it a thumbs up for me, and don't forget to subscribe to my channel. Also, if you have any questions or just want to share your experience, leave them down in the comments below. Thank you so much for watching, and good luck on your postpartum journey. I'll see you soon. No, I got it on me.